Good afternoon, everyone. Thank you for joining us today. I want to start immediately today with a very important update on the cluster of cases that we have been dealing with in Aberdeen in recent days. And I would ask everyone in Aberdeen and indeed Aberdeenshire to take particular note of what I am about to report. My comments will undoubtedly spark a lot of questions, and so further detail will be provided later today on the Scottish Government website, but I want to give the headline information direct to you now. Firstly, let me set the context. When the Aberdeen cluster was initially reported by NHS Grampian at the end of last week, there were 4 identified cases as part of it. Over the past few days, a test and protect team has been tracing the contacts of those individuals. They and the local incident management team are doing an exceptionally good job, and they have my deep appreciation for that. However, I can confirm that as of now, a total of 54 cases have been confirmed as associated with that cluster. A total of 191 close contacts have already been traced, although we expect that number to rise over the course of today. And in the past 24 hours, across the whole of Scotland, a total of 64 new cases have been reported. A full Health Board breakdown will be available later as usual, and I'll come back to say more about the national figures shortly. But my provisional information is that 36 of these 64 new cases are in Grampian. Now, it's not yet clear how many are connected to the outbreak in Aberdeen, and indeed, let me be clear that some of these may already be counted in that most recent figure for the cluster that I have just given you. But this high number of cases certainly considerably heightens our concern that we are dealing with a significant outbreak in Aberdeen that may involve some community transmission. Now, the main link identified in this cluster so far has been the Hawthorne Bar in Aberdeen city centre. However, more detailed analysis by NHS Grampian and Test and Protect has shown that this one venue does not account for all of the positive cases. Indeed, in total now, more than 20 other licensed premises are part of the contact tracing picture. So when we take all of this information together, we have been led to the conclusion that we must now take further immediate steps on a highly precautionary basis to prevent further spread and to give the Test and Protect teams the best possible chance of successfully breaking these chains of transmission. Earlier this morning, I chaired a meeting of SCORE, which is, as you know, the Scottish Government's Resilience Committee, because I wanted to consider the latest data that we had overnight and also what our response to that should be. NHS Grampian, Police Scotland and the leaders and Chief Executive of Aberdeen City Council played a full part in that meeting, and I'm very grateful to them for their constructive and very helpful contributions. And I want to assure you that the decisions we agreed this morning and that I am about to confirm to you now are not being taken lightly. But we are at a stage of this pandemic where extreme caution is necessary and also, in my view, sensible. I'm also mindful of the need to act quickly and decisively if we are to succeed in our aim of keeping transmission as close to elimination levels as possible, and also to protect our priority, and it is our priority, you've heard me say that before, of getting young people back to school. Indeed, I was struck this morning by a comment from the Children's Commissioner for England. She said, and I'm quoting, "If the choice has to be made in a local area about whether to keep pubs or schools open, then schools must always take priority." I agree with that, and so did the leaders of Aberdeen City Council. And that is one of the very important reasons that we are taking firm action now. So I can confirm that it was agreed at SCORE this morning, albeit, as I'm sure you understand, extremely reluctantly, to reimpose some restrictions on the Aberdeen city area. And I want to set out what those restrictions are. Though let me remind you, because I know particularly for people living in Aberdeen, there will be lots of questions, that we will make more detail available over the course of the day to give as much clarity to people as possible. But firstly, our travel guidance to people in Aberdeen from today is that you should no longer travel more than 5 miles for leisure or recreational purposes. You may continue to travel for work or education, but we advise against other travel. We're also advising people who are not in Aberdeen not to travel to Aberdeen. If you are already in Aberdeen visiting family or on holiday, you can stay, but please follow all of the guidance while you're there and take extra care when you return home. Secondly, from today, people in Aberdeen should not go into each other's houses. Extended household groups can continue, but remember these are situations which should only involve one other adult who is living on their own. And finally, we will be introducing regulations, we will publish these later today, requiring all indoor and outdoor hospitality in the city to close by 5 p.m. today. That includes all bars, restaurants, cafes and pubs. Hotel restaurants can remain open, but to provide food for residents only, and takeaway services can continue, but all other pubs and restaurants and cafes must close. This restriction on hospitality will be backed by regulation, so if necessary, it will be enforced. But I would expect, given the responsible way they have behaved in recent days, the owners of these businesses in Aberdeen will act voluntarily and continue to be responsible. And I want to thank businesses in the hospitality trade for their cooperation so far. These regulations and the associated guidance and advice will be reviewed in 7 days' time, by which time I hope we will be in a better position to judge the scale and the trajectory of this outbreak. And at that point, if these restrictions can be removed, we will remove them in their entirety or in part. But I should also give notice that if it is considered necessary, we may extend them beyond the initial 7-day period. Finally, if you're contacted by Test and Protect in Aberdeen, please comply with their advice. In fact, if you're contacted by Test and Protect anywhere in Scotland, please comply fully with their advice, particularly in relation to self-isolation. And we will also make available this afternoon a list of the more than 20 licensed premises that are part of the contact tracing operation in Aberdeen. And if you have been in one of these premises in the last 2 weeks but have not been identified as a close contact, our advice is to still be extra vigilant, looking out for symptoms, and also to particularly rigorously follow all of the facts public health advice. Now, I know that all of this is deeply unwelcome news for people in Aberdeen. It's very unwelcome news for all of us. I did not want to be standing here today making these announcements, and I'm very sorry that we are in this position. I understand the impact these measures will have on individuals and on businesses, though let me emphasise that where a business has brought staff out of furlough, those staff can be re-furloughed as part of the jobs retention scheme. But generally, the last thing we want to do is reimpose these kinds of restrictions. But this outbreak is reminding us just how highly infectious COVID is. So our precautionary and careful judgment is that we need to take decisive action now, difficult though that undoubtedly is, in order to try to contain this outbreak and prevent further harm later on. As I said earlier, this is also about doing everything we can to ensure our children can return to school next week. Aberdeen schools are holding orientation sessions from next Wednesday, with schools due to open fully the following Monday, 17th August. Acting now, we judge, gives us the time and the space to protect the ability of our young people to return to education. We've seen plenty of instances in other countries where outbreaks have run out of control because action has been taken too late. There are no guarantees for any of us in any of this, but we want to do all we possibly can to try to avoid that happening here. Now, let me turn to the normal statistical update for the whole of Scotland. As I've already reported, an additional 64 positive cases were confirmed yesterday, which includes the 36 in Grampian that I mentioned earlier. There are also 15 cases, according to my provisional information, being reported in the Greater Glasgow and Clyde area, and we will be paying very close attention to those and any possible patterns there as well. These 64 cases, which is the highest daily number we've reported for quite some time, represent 1.3% of the people who were newly tested yesterday, and they take the total number of positive cases in Scotland now to 18,781. A total of 267 patients are currently in hospital who have been confirmed with the virus. That is 3 fewer than the number yesterday. and a total of 3 people last night were in intensive care with confirmed COVID. Yesterday's reported figure of 4 was later revised down to 3, so today's number is actually the same as yesterday. And finally, in some very welcome good news today, I'm glad to say that yet again during the past 24 hours, no deaths were registered of a patient confirmed through a test in the past 28 days as having COVID, and the total number of deaths under this measurement remains at 2,491. However, National Records of Scotland has just published its weekly report. It includes deaths of people who've been confirmed through a test as having COVID, just like our daily figures, but it also covers cases where the virus has been entered on a death certificate as a suspected or contributory cause of death, even if a test hadn't been carried out. That is a wider measure and therefore captures more cases. The latest NRS report covers the period to Sunday, 2nd August. At that point, we had 2,491 deaths recorded of people who had tested positive for the virus, although none of these had been registered in the 7 days up to Sunday. Today's report shows that by Sunday, the total number of registered deaths with either a confirmed or presumed link to COVID was 4,208. And of those, 7 were registered in the 7 days up to Sunday, which is a decrease of 1 on the week before. 2 of those 7 deaths were in care homes, which is the same number as the previous week. National Records of Scotland has also reported that the total number of deaths recorded last week from all causes was 40 higher than the 5-year average for the same time of year. I'll put that in some context though. Last week the average was 16 lower, the week before it was 37 higher, the week before that it was 49 lower, so it's not unusual for that number to fluctuate a little bit. In general, though, these figures show the same trend as our daily figures. They confirm that COVID, as of now, has been driven to very low levels in Scotland. But the main part of my update today should remind all of us that we have absolutely no room for complacency. The figures also remind us that more than 4,000 people have lost their lives to this virus. Each one of those was an irreplaceable human being whose loss will be mourned by many, and my condolences again go to everybody who has lost a loved one. And I also want to thank all of our health and care workers, not least today those in Grampian, including our public health teams working there, for the incredible job that they continue to do. To close today, before I hand over to the Chief Medical Officer, I want to return to a familiar but very important point, and it feels even more important today. This virus hasn't gone away. If you doubted that, then today we have evidence of how true that is. It is still out there, and it is still highly infectious, and it is still highly dangerous. The outbreak in Aberdeen is a sharp reminder of that. It shows what can happen if we let our guard drop, and it should serve as a warning to all of us. Just because many of the restrictions have been eased across the country doesn't mean we can simply go back to normal. We are still in a real daily battle with this virus, and so we must all continue to exercise extreme caution. Test and Protect is vital, and it is doing a fantastic job. But Test and Protect cannot beat the virus all on its own, and it is absolutely not some kind of get-out-of-jail-free card for the rest of us. Every single one of us are the first line of defence against this virus. If the virus gets past us, Test and Protect steps in and tries to keep it under control, and as I say, so far they are doing a really good job. But by definition, their job is always firefighting. Our job as citizens, as human beings, is to try to make sure the fires don't start in the first place. We need to make sure the virus doesn't get past our defences. The Facts campaign summarises the 5 rules we must follow whenever we are out and about. So please remember facts and please stick to these rules wherever you are. F, face coverings in enclosed spaces, shops, public transport or anywhere else inside that physical distancing might be more difficult. A, avoid crowded places, indoors obviously, but outdoors as well. Avoid all crowded places. C, clean your hands and hard surfaces regularly. T, 2-metre distancing remains the overall advice. And S, self-isolate and book a test if you have any of the symptoms of COVID. If we all remember these 5 basic measures, then we can all help to make sure that we keep this virus in retreat and don't allow it to get a grip of us again. So my thanks to everyone who is abiding by that, and my thanks in particular, not just for past efforts, but for the difficulties I know you will be facing in the days ahead, to everybody in Aberdeen, and we will continue to do everything we can to get this virus there under control and to keep you fully updated on all developments. I'm going to hand over now to the Chief Medical Officer to say a few words before we go to questions from journalists.
Thank you, First Minister. So I want to start today by saying thank you and paying tribute to the people involved in dealing with the outbreak in Aberdeen, both in the Test and Protect and the local incident management teams. This has been an excellent effort in a very complex environment to understand and track the extent of this outbreak that the First Minister has outlined today. But I also want to emphasise that Test and Protect is not the first line of defence in combating COVID-19. We are, each one of us. Each of us has a responsibility to ourselves and to others in our community to act in a way that helps prevent COVID-19 from re-emerging and gaining a grip on sustained community transmission again. I believe that we all know what to do, but we need to make sure that we follow the guidance. Otherwise, I'm sure that this will happen. This is not something that others can take care of for us. This is our collective responsibility. So if you have symptoms, a sustained cough, fever, or a loss of change, or a change in the sense of smell or taste, I need you to self-isolate, and I need you to book a test by going through the NHS Inform website or by phoning 0800 028 2816. 0800 028 2816. If you've been contacted by Test and Protect and advised to isolate for 14 days, a negative test doesn't mean that you can stop this isolation. It's critical that you self-isolate for the full 14 days. This is because the virus can take up to 14 days to incubate. And so even if you have a negative test at the start of this period, you could still become infectious and spread the virus to other people later on. Again, the first line of defence is the action that we take ourselves. This is our responsibility. So ensuring that we wear face coverings when we're in enclosed spaces, especially in public transport and in retail shops where it's mandatory, avoiding places that are crowded, taking that decision that a place just looks too busy to be in. This virus especially loves spreading in crowded indoor areas, so don't give it the opportunity. When we look around the world, when we look at some of the outbreaks that have taken place in other countries, one of the common factors that we continually see is that these have begun in crowded indoor spaces. Making sure that we clean our hands with warm water and soap, using sanitizer regularly and cleaning the surface around us regularly too. Keeping our distance from others, where 2 metres remains the default advice to reduce the chance of this virus being transmitted and you being infected or contacted by test and trace. And as I've already mentioned, if you have symptoms of cough, fever or loss or change in taste or smell, self-isolating immediately and booking a test. We've all got a part to play still. The coronavirus hasn't gone away, and I need your help in making sure it doesn't reignite the chains of transmission across the country that we saw before. These figures that we're reporting today and the outbreak that we see in Aberdeen remind us that it's not time to drop our guard yet.
Thanks very much, Gregor. I'm going to go to questions now as usual. David Shanks from BBC Scotland is first.
First Minister, the sharp rise in cases you've outlined today and accounts from Bars and Aberdeen of hearing of cases related to them but having no contact then with health officials. Have tracing efforts and enforcement kept up with the spread here? And could you envisage further restrictions coming in the future?
Test and Protect is doing a very good job, and Test and Protect will make judgments about whether people need to be contacted because they are close contacts or not, and we have to trust our experts to make those judgments. The other purpose of Test and Protect, of course, is to give us early information about the potential sources of and patterns of spread. So it's because of Test and Protect that we know that there are more than 20 licensed premises that may not have had cases, but where people who've been identified as contacts might have been. So we are able then to look at this on an overall basis and decide to help Test and Protect and to try to add to those efforts to break transmission of what actions are best to be taken. So this is complex, but I know that the work that has been done locally has been done extremely well, and this will be an ongoing situation, I'm sure, for quite some time. You know, I've been getting asked all week, are we considering measures, and I've said all week, if we consider measures are necessary, we won't hesitate, and that is what we are demonstrating today. I'm not going to speculate any more than I did earlier in the week about what I'm announcing today about any further measures, but suffice to say, none of this is easy, none of this is action we want to be taking, but if we judge based on all of the data and analysis and work that local teams are doing, that measures are necessary to keep this virus under control, to protect the ability of children to get back to school, then we will not hesitate to take those actions. But I'll come back to the central point here. We all have a part to play here. Every time we have cases going from one person to another, this is not about trying to blame people. Please don't think it is. We're all finding this difficult, and none of it is foolproof against an infectious virus. But every time one of us doesn't abide by part of the health advice, we give the virus an opportunity. So the reverse of that is if all of us abide by all of this all of the time, we limit the opportunities for the virus to spread. So I come back to this point that we all are the first line of defence here. If it gets past our defences, which it will do sometime, although we want to limit that, test and protect is then the second line of defence. But let's try and focus on not allowing it past the first line of defence. And if we all, as individuals, focus on that, then we are helping the overall effort to keep it under control. Stephen Brown from STV.
Good afternoon. First Minister, you've obviously put these measures in place for 7 days ahead of the schools reopening, but I'm wondering, given all through this pandemic, you've often said things would have to be reviewed 3 weeks to see whether or not measures have really made a difference. Can people be confident, are you confident that you will know enough in 7 days' time to have seen the measures taken today, whether or not they will make a difference then?
No, I can't be absolutely confident of that right now, which is why I've said openly we will review them in 7 days, and it may be that in 7 days' time we have greater confidence that the test and protect effort has contained it, but we may not have that greater confidence either because we need more time to assess that, or we may have evidence to show that it has actually spread further. So I can't, unfortunately, look forward 7 days and predict with certainty what I'll be standing here then reporting to you. But I think, given that this is the first time in Scotland, and I hope there won't be many others, but I can't rule this out, the first time we have reimposed restrictions, I think it is important to keep it under more regular review, because I don't want people to be, in any part of the country, to be living under restrictions that others are not for any longer than is necessary. But I'm trying to be straight with people. There's a lot of inherent uncertainty in what we're dealing with right now. I think it's also fair to say, and I tried to give the sense of this in my opening remarks, that we have very deliberately here taken a very precautionary approach, because I want, if we can, to stamp on this outbreak before it spreads further in Aberdeen and perhaps gets out of Aberdeen and spreads more widely in the country. But if 7 days from now we think that concern is less, then perhaps we can review things. So let's take it step by step, and all of us do the right thing every day between now and then. Alan Smith from Bauer.
Thank you, First Minister. You mentioned that businesses can re-furlough staff. Is the Scottish Government looking at any additional financial support for those businesses then that will be closing? And on the point of review and perhaps how long these restrictions could be in place, what measurements is it that you'll be looking at? Is it the number of cases? Is it tracing all the contacts affected here?
So in respect of the first part of the question, I think the point about the ability for businesses to re-furlough staff who've been brought out of furlough is the key point in the first instance to make sure businesses are aware of. Clearly, the Scottish Government, yes, will be looking at whether or not there is additional measures we can take and additional support we can provide. Not surprisingly and entirely legitimately, it was a point raised at the resilience meeting by Aberdeen City Council this morning, so we will be having further discussions around that. We will also, and again, this is not a political point, it's just a reflection of reality, we will be raising these issues with the UK Government, because all parts of the UK are going to face these situations, and the furlough scheme, although it has been reined in a little bit, is still in place right now, but in 2 or 3 months from now, on current UK Government plans, that will not be the case. So we need to continue to have these discussions on an ongoing basis, and we will. On the, Gregor, want to add to this, it will be a mixture of all of these things. At the moment, from My layperson's point of view, although somebody who's obviously been immersed in this for 4 months now, my worry, I chaired a meeting with NHS Grampian Leeds at 5 o'clock last night. My worry then, which was compounded when I had the meeting early this morning, was that there is a rapid rise in the number of cases being identified right now. Now, contacts are being identified and traced. We're, I think, almost at 200 contacts that have been traced already. But there is not yet any certainty that we don't have wider community transmission. And that's the reason for caution. Now, I hope in a few days from now, we will have a much greater sense of where these cases have come from, what the links are, and that there's no greater community transmission. But when you've got in a contact tracing exercise more than 20 licensed premises, then the real risk of this spreading out of a very contained outbreak is very real. And that's why we've got to take the decisive action that we are talking about today.
So thank you. I mean, clearly this has been a very rapidly evolving situation that has happened, particularly over the last few days, and we're seeing these rising numbers. One of the things that we'll be doing with constantly over the next 7 days until the next review point is working closely with colleagues from the Public Health Department, the health protection teams in Grampian to understand their local data with them. We'll be looking at some of the positive cases that they're getting, but further than that, we'll also be looking at the yield of positive cases from the degree of testing that they're getting. And as they begin that contact tracing process with each of these individuals is to see whether we are chasing down and gathering the evidence of all these chains of transmission. I guess what we're trying to make sure that we're doing here is to discount that there may be ongoing community transmission in that area that we need to take these further actions for longer for.
Well, also, it's worth just saying, and I may come back and say more about this later in the week, but we'll be looking for lessons that we can apply elsewhere in Scotland. And, you know, I'm speculating at the moment, which you've heard me say I don't like doing, so I'm breaking my own rules here. But it could be that what we see here is a pattern that has involved people going from one pub to another on the same night. Now, it may be that we have to look at some of those lessons to think about whether we need to tighten up some of the restrictions about how hospitality is operating across the wider country. Now, I don't want to rush to conclusions on that, but equally I want to make sure that we are fairly rapidly doing some assessment of that nature. As I say, I may have more to say on that later in the week. Fraser Nicholl from Original 106.
Thank you, First Minister. The COVID-19 crisis and the low oil price has created what's being called a perfect storm in the northeast of job losses, businesses closing, and increased demand at food banks and mental health services as well. With this latest blow, what assurances can you give to the people of Aberdeen and the northeast?
As I said earlier on, we will have discussions with the Council about how the Scottish Government can support. I know Aberdeen City Council will be looking at what they can do as well. We have given, rightly and properly, significant support both for business and the economy across Scotland, but also for communities as well, and to help people who are living in poverty that is undoubtedly being exacerbated by some of these conditions. So as we go through this pandemic and as different areas will face challenges as we go, we will need to make sure that we continue to respond appropriately. The final thing I would say here, though, and it's not an easy thing to say because these consequences of the kind of actions I've announced today are very real, and I don't underestimate them at all. This has been in a 4-month period of difficult days for all of us, including government in this. This has been one of the toughest so far because we are, for the first time, reimposing restrictions that none of us wanted to see in the first place and certainly don't want to see return. But the worst thing that could happen for any part of Scotland, Aberdeen or any other part of Scotland, is this virus getting out of control again, because any damage that has already been done through the lockdown measures would be compounded if we allow the virus to take a grip of us again. So all of what we are doing right now causes damage and harm, and that has been true from day one, but it is all in the interest of trying to prevent greater damage and harm being done further down the road, which doesn't make it easy for those living with the consequences of this, but hopefully gives some context to why these really difficult and not so long ago completely unthinkable decisions are having to be taken. Phil McDonald from Global.
Thanks, First Minister. Lots of people who will have been in Aberdeen during the outbreak will have travelled in from Aberdeenshire. So what would you say to people who have been in the city recently and live in the Shire who may be asymptomatic? And what advice would you give to bars and restaurants who are on the border between the city and don't have to close and may be worried now about the risk of these people arriving at their premises and potentially spreading?
So that's a very good question, and the obvious linkages and intertwining of Aberdeen and Aberdeenshire was one of the issues that we discussed this morning at the SCORE meeting. Right now, the restrictions that we are announcing apply to Aberdeen City, and I want to be clear about that, but there will be ongoing analysis of the Test and Protect data to see whether it may be necessary to extend these restrictions to some parts of Aberdeenshire, but we will only do that if we deem it necessary, and we haven't taken that decision yet. In the meantime, the advice to anybody who has been in Aberdeen, particularly in the, if I can describe it as the nighttime economy, if you've been in pubs in Aberdeen over the past couple of weeks, if you've had a night out there, wherever you live, be extra vigilant. If you're contacted by Test and Protect, do what they advise you. And even if you're not, be extra vigilant. That means watching out for symptoms, making sure that you are absolutely rigorous. I want everybody to be rigorous when it comes to facts, but if it's possible to be extra rigorous, then do that. And for businesses in Aberdeenshire, and in particular pubs and restaurants, and this is actually advice to pubs and restaurants everywhere, be really rigorous in the application of the safety measures that the guidance says you should be complying with. And that is about cleaning, it's about staff wearing the appropriate protective equipment, it's about taking the details of people who come in so that they can be contacted if there is any concern. All of these things are really important, and so please tighten up on these rather than allow the standards to slip, as it may have been the case. Almost, I suppose, human nature, individuals, businesses, there's real sort of paranoia about it at the start, and then slowly but surely we get less used to it. It's time to tighten up again, and that applies, I think, particularly to businesses in the hospitality trade. Neil Pooran from PA.
Thanks, First Minister. In terms of how the virus spread, initially at the Hawthorne Bar and potentially in other pubs as well, has the incident management team identified any particular activities that might have caused this, or any particular events, perhaps certain guidelines that weren't being followed? And if I can also ask, I know you've spoken previously about how you saw pictures on social media of people in Aberdeen sort of crowding together outside pubs. Do you feel that some of your fears have come to light after you were first worried about seeing those pictures?
Gregor may have want to say a word or two about transmission risks. The work of the IMT is ongoing, so I don't want to sort of get ahead of where they are. They certainly haven't got a completed picture of how the virus is transmitted. In fact, that's one of the reasons why we're acting in the way we are, because there isn't as clear a picture of exactly how it's spread from one person to the other as we would want there to be in an outbreak like this. In terms of my fear, look, I'm standing up here today doing what I didn't want to have to do, which is reimpose restrictions on a part of the country. So in that sense, yes, my fears have been realised. I don't want that to sound, though, as if I'm blaming people. I know how difficult this is. I know how terrible it is for us to be living under these restrictions. None of us enjoy it. None of us, I'm sure, are perfect in our day-to-day compliance with these things. But what I would say is that where we have reached today in Aberdeen should be the biggest wake-up call in this pandemic since the early days of it. It hasn't gone away. I so wish it had gone away. And so what I've been telling you about Melbourne and about even the north of England and parts of Spain and other parts of the world, that's been real and that's been worrying me for the last few weeks. But I guess it's far away, and there's always a sense of, we're doing well and it won't happen here. It can happen here, and it is happening here in Aberdeen. So please take this as the biggest, loudest warning yet that this virus is still out there. We've forced it into retreat in the last few weeks, but the battle is not won against it. This is a battle for the foreseeable future that we have to fight and refight on a daily basis. And as I say, all of us are the first line of defence against it. So it does come down to every time one of us forgets to wash our hands when we go in somewhere, every time one of us doesn't wear a face covering on a bus or in a shop, every time you touch a hard surface that somebody else might have touched without cleaning it, every time you creep closer to somebody in another household than the 2 metres distance, you're giving the virus the chance to spread. And that's what we have to absolutely guard against, to try to stop the fires starting that then Test and Protect has to work round the clock to put out. So it does come down to all of us, and that's a hard place for us to be, but it's where people right across the world are right now. So that really is the most important thing for all of us to remember. Gregor.
So thank you. So in answer to the first part of your question, the IMT are clearly looking at this with a great deal of interest to try and understand what the modes of transmission might be in what is a really complex outbreak. At this moment in time, they haven't clearly been able to elucidate that from the questions that they've got the answers to from people. But what we know in general is that there are certain characteristics that make transmission much more liable. So the further away you are from someone, the less likely you are to catch it. 2 metres is better than 1 metre, and 1 metre is better than direct contact. That all gets factored in. We also know that indoor transmission is much more likely than outdoor transmission. Poorly ventilated indoor places that are crowded start to become an environment where the risk of transmission becomes much, much more likely. All these things will be taken into consideration. Now, the IMT will be considering all this at length and will issue a final report. But in the meantime, what they will also be doing is they'll be feeding the learning from the discussions that they're having over the course of their action back to us so that we can learn and perhaps reflect on that and reassess whether there's any further measures we need to take on a wider basis.
Thank you. Christine Lavelle from The Sun.
Thank you, First Minister. It was just to clarify, are all 54 cases in the near 200 close contacts people who actually live in the city, or is there any evidence at this point to suggest that the outbreak could have spread to any other parts of Scotland?
That's a good question. I don't have the breakdown in front of me, but there are some who have been in Aberdeen, so I think there is a confidence they are associated with the cluster in Aberdeen, but may not live in Aberdeen. But my understanding is the majority live in Aberdeen, but we'll see about trying to provide a bit more detail in terms of a breakdown of that. And all of these links and patterns are exactly what the IMT are looking at as they try to manage it. Vivian Aitken from The Record.
Good afternoon, First Minister. Obviously, there's a greater emphasis these days on testing, and I have raised this issue before, but it continues to be a concern for nurses who still fear the PPE they've been issued to carry out COVID testing is insufficient to protect them from the virus. Currently, only surgeons' masks are used for this procedure, which is an aerosol-generating procedure in that it produces a cough. As an AGP, staff feel they should be wearing FFP3 masks and gowns to carry out this vitally important work. Soldiers who man testing stations do not carry out testing themselves because they only have surgeons' masks, which they say is not sufficient to carry out this work. If a person being tested cannot do the test themselves, soldiers are required to use what they term proper PPE, namely FFP3. If that's important enough for our soldiers, why not our nurses? Nurses tell me they've been made to feel dispensable and not as important as the army and as also, I believe, the fire service, who also wear the same equipment. The Chief Medical Officer said the last time I raised this that the surgeons' masks were recommended with recommendation nerve tag, but the body also says the evidence on this is weak and staff should wear what they feel is appropriate. So why is FFP3 not being made available to them?
Vivian, well, firstly, the idea that any of our health or social care staff are, to use your word, dispensable is just, I cannot refute and counter that strongly enough. You know, we owe such a huge debt of gratitude to people working in the NHS and in social care. We work hard to protect them, which they deserve, and support them in whatever way we can. We will always listen to concerns and seek to respond appropriately. I know I'm no different here to the majority of people across the country, but I have close family members of my own who work in these frontline positions. So I understand, not just as First Minister, although I understand it in that role, but I understand it as a an individual human being how important these things are. I'm not a clinician, I'm not an expert. I rely on advice on the appropriate use of what PPE in what circumstance from experts, and the guidance we have around PPE is informed by expert opinion. I will certainly, Gregor will want to say something just now, but I will take away your question and ask a question of my advisors again to make sure that there is confidence in the advice that we are giving. But we don't make any of these decisions or draw up any of this guidance lightly, and I want that to be clearly understood. Gregor.
So I would emphasise again that all staff working in health and social care have been given the PPE that's appropriate for the tasks that they're undertaking, and it's really important to emphasise and restate that at the beginning of this. NERTAG has provided their expert opinion on what constitutes an aerosol generating procedure, and the National Infection Prevention and Control experts have developed guidance on the basis of that. But we've gone even further than that, because now an independent panel of experts has also been formed and commissioned by the 4 UK CMOs to re-examine all the potential aerosol generating procedures which might take place across the country, and to opine and give advice as to whether any further changes are meant by that. So I'm as confident as I can be that the protective equipment that our staff are currently provided with is based on the firmest evidence and is appropriate for the tasks that they're undertaking.
Thanks. Conor Matchett from the Scotsman.
Thank you, sir. I will.
Sorry, Conor, you're not. Sorry, Conor, you're very distorted. Can you try again?
Am I any better now?
That is a bit better, yeah.
Fantastic. So thank you, First Minister. I was just wondering if you could elucidate a little bit on at what point you saw it as a tipping point for reimposing lockdown some restrictions on Aberdeen, and also at what point you would view restrictions as necessary for the rest of the country. And secondly, if I may, how confident are you that the reopening of tourism in Scotland and staycations hasn't or won't increase the risk of similar outbreaks taking place in other parts of Scotland?
So on the question about risks, there is risks associated when we are in the face of a very infectious virus. There's risks associated with everything we do, and I can't guarantee that those risks don't exist. We are having to balance managing those risks with carefully opening up our economy, because the closure of our economy does lots of damage as well. But that's why as we open up, it becomes more important that all of us follow all of the advice, which is about minimising and mitigating those risks as much as possible. And, you know, whether you are in Scotland visiting or working or living or doing anything, it's following the facts, rules that will give us the best possible chance of making sure those risks of transmission don't materialise. On the questions about tipping point, these will always be careful judgments, and I've always, I suppose, been reluctant, because they don't really exist, to give absolute trigger points for doing things. There will be a range of different things that have to be taken into account, and that will be true, you know, when we're dealing with outbreaks in any part of the country. But with Aberdeen, you know, I chaired a meeting last night when I think we had just over 30 confirmed cases, and there appeared to be another 20 that were possibly going to be associated. Today we've got, you know, 54. But this morning, and we see this in our reported cases today, there was concern about another, you know, possibly more than 20 that could be associated. So it feels to me as if we are in Aberdeen are rapidly accelerating, with the number of cases doubling in a sort of every couple of days. So with a situation like that, there is a real need to act quickly. The other factor, and if I can contrast this with the outbreak in Inverclyde last week, in Aberdeen, and this is not a reflection on the people working on this, they are doing a sterling job, but they are not yet able to be certain that they know exactly what all of the routes of transmission are. So the Hawthorne Bar has appeared to be at the centre of this, but the further analysis has shown that we're not certain that all of these positive cases either started there or can be tracked back to that bar. And there are a number of other bars now in scope. So there's a lot of uncertainty remaining around the chains of transmission. And when you've got an uncertainty around what the chains of transmission are, by definition, you've got an uncertainty about whether they are being broken effectively. So it's that uncertainty, as well as what appears to be quite a rapidly accelerating position, that certainly led me and SCORE this morning to the view that we had to act quickly to put in place additional measures to stem the spread while Test and Protect gets on and does its work. Gregor, do you want to add to that?
Yeah, I think, as I say, I've used the word complexity quite a few times today, and this is a very complex situation given the number of venues which are potentially implicated with people who have tested positive but have been part of those venues. I think that one of the most striking things about this is the need to take very firm and decisive action to prevent further spread within that community just now, to make sure that those chains of transmission which have been established are broken, to allow the Test and Protect teams to get on and do the job. When we look around the world just now, whether that be Europe, Asia or even the United States, one of the common features that we're starting to see coming out of these places when the infections re-emerge is that sometimes if by the time that people think that it's time to take action, it's already too late. And one of the things that I guess that I would have been most fearful is if we had continued to wait for further data and seen the rise in cases that we've seen, particularly over the last couple of days. I think had we done that, it would have been already too late to stop this from escaping into the community.
Thanks, Gregor. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Can I please check whether any extra police will be deployed in Aberdeen to enforce these rules if necessary? And also, could you expand a bit on why non-essential retail is being allowed apparently to stay open? I mean, why is going for a meal in a restaurant more dangerous than going into a shop and mixing with people there? Thanks.
Well, on the police point, I'm not going to comment on the operational decisions of the Chief Constable. Suffice to say, Police Scotland were represented on the resilience meeting discussion this morning, as they very frequently are. DCC Will Care took part in that and contributed fully in terms of the enforcement requirements here and the actions that the police would be ready to take. The police have conducted, I think, this whole themselves through this whole situation incredibly well, where they have stepped in to take enforcement action where necessary, but being part of a collective effort to persuade people of why they're being asked to do certain things and encourage the voluntary compliance with these measures. And that will be important in Aberdeen as well. On your point about why pubs are not non-essential retail, look, there will be in every single situation we face here, there will always be questions why X and not Y, that there have been throughout it. And these are not always simple questions to answer. Part of it is about certainly countrywide, it's about the not just the individual things we're talking about, but the cumulative impact. What we know in Aberdeen so far is that we appear, and let me caution and caveat this is still under investigation, so it's subject to change as we understand more about the outbreak, but at the moment, based on the information we know, it appears to be that it has been the nighttime economy, that the pubs and restaurants that perhaps have been more susceptible here. So we are acting there. We are also acting to ensure that we minimise the risk of transmission indoors with different households mixing. That is a precautionary approach, but we're trying not to be disproportionate. We want people, as far as possible, with those exceptions, to be able to go about their everyday lives. And non-essential retail, you must wear face masks, of course, in shops. Shops have other requirements to comply with. So that's the judgment at the moment. But as with all of this, these judgments are subject to change. And unfortunately, that's just the uncertainty we're all living with right now. But we will try to get these judgments right and take them in the best balance that we possibly can. And that's what we've tried to do here today in Aberdeen. Do you want to add anything?
I think just to emphasise that non-essential retail is a very different environment than you would find in the hospitality sector, where people don't tend to kind of linger, sit at hard surfaces for the length of time that you would in the hospitality centre. And when you look at the approach that we took in terms of the exit from the restrictions through the route map, some of the considerations that we made in that time is what could we safely reopen and in what order, and non-essential retail certainly was a much safer environment to consider reopening at that point in time than to open, whether it be pubs or restaurants later. So it relates to the degree of risk that is associated with any one environment, and as I say, the analysis that has been done in this shows that hospitality sector, unfortunately, because of reasons of, well, multiple reasons, it tends to be one where transmission is much more closely associated.
Adele Merson from the P&J.
Thank you, First Minister. Individuals who have contracted the virus in recent days could take around a week or longer to exhibit symptoms. Is it therefore unrealistic that schools can reopen in the city in a week's time? And when can parents expect a decision on that?
Aberdeen City Council's plans for the reopening of schools have already been communicated. We want those to continue as planned, and don't underestimate the factor here in the decisions we've taken today, which is about protecting the ability of schools to return. So this is about being more precautionary elsewhere in order that we stamp on transmission so that children's return to school is not compromised. I've said for the past few weeks that getting children back to school is the priority. And this, I'm afraid, is the hard edge of what that means in practice when we're facing increased transmission. It's always a bit invidious to make it binary and black and white, but the Children's Commissioner in England this morning, I thought, summed it up well, although it is more complex than this in reality. But if it is a choice between hospitality and schools, we are choosing schools right now. And that is because we know that it is in the interests and for the well-being of young people to get them back into education. So this is about protecting that, not having that compromised, which may happen if we were not to take really decisive action. Andrew Learmonth from the National.
Thanks, First Minister. Does the situation in Aberdeen highlight the difficulties in enforcing distancing guidelines with people who are drunk? I mean, are you both confident that it's safe for Scotland's pubs to be open?
Look, we have balances that we have to strike. We need to get our economy going, because not having our economy going is doing damage in many different ways to people's health, their living standards, their ability to pay their bills. So that's important, but none of that is going to be possible longer term if we don't keep this virus under control. So, we have to continue to try to strike these really difficult balances as well as we can. And sometimes, and we've always said this, although we all hoped it wouldn't happen, we might have to go backwards. As Gregor said a moment ago, hospitality took a bit longer to reopen than shops. Indoor hospitality took longer than outdoor hospitality. So we know these kind of environments, for a whole host of different reasons, can be more risky. And it means people have to be even more careful when they're there, which, not to put too fine a point on it, when alcohol is involved, of course, people's inhibitions are perhaps a little bit lower and it may be more difficult. So none of this is easy, but we have to continue to be precautionary, be cautious, act where it's necessary, even if it's not popular, persuade people to stick by all the rules, and manage and navigate our way through this really difficult situation as best we can. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just picking up from your earlier remarks about, the need to act quickly from experience in other countries, could you just explain a little bit of why this decision's been taken now, and could you have perhaps acted sooner? And if I may just follow up from an earlier question about, transmission further afield, is there any evidence of this sort of coming in from outside Aberdeen?
Well, there is a lot of examination underway right now about the cases, whether some cases have come back from overseas or come back from other parts. So, that is the work that is underway to identify that. And inevitably, you will undoubtedly have cases where there have been elements like that. But does that mean that's what started it or not? We don't know yet. And it's some of the uncertainty around it at the moment that has necessitated this action. Should we have acted quicker? I probably for the rest of my time will agonise over, the timing of decisions and, do we get the balances right? We're trying our best here. The first case in this cluster was identified last Friday, if memory serves me correctly. It's Wednesday. It is in the last 28, 48 hours that there appears to have been a rapid acceleration. So we've acted, I think, pretty quickly. But we'll always, look back and review. And as, unfortunately, we're going to be living with situations like this for quite some time to come. So we will always look and see whether there are things, if we had to do it again, we would do differently. But we are trying our hardest to get these decisions right and to factor in all of the different circumstances, economic, social, health, that we have to take account of in reaching the best decisions we can. But I think here we are acting quickly, we're acting decisively, we are taking, rather than just putting a travel limit on or limiting indoor meetings between households or closing hospitality, we've decided to do all three at the same time to try to bring as much of our sort of armoury to bear on it as quickly as possible to hopefully get it under control as quickly as possible. Rachel Watson from the Daily Mail.
Thanks, First Minister. I just wondered if I could go back to the SQA results from yesterday. There's been a lot of concern about the methods used, and it was yesterday said that this overall it was fair. But critics, including Professor Lindsay Patterson, have said that the system didn't recognise individual pupils for their merit and how they had performed over the school year, and that it was actually more about schools and how they had performed. Do you therefore admit that there are some children who have not been graded fairly because of this? And what is your message to them over how this has been handled? So
this is a really important question. And if I take Lindsay Patterson's comments, I saw comments from Lindsay Keir Bloomer, who's, I think he won't mind me saying, a fairly significant critic of the Scottish Government on education, actually making some contrary comments to that. If yesterday had been the end of the journey here, then Lindsay's comments, I think, would have more force, but it is not the end of the journey. This year, because exams couldn't go ahead, we had to, the SQA had to find a different way of assessing the achievements of young people. And I suppose whatever way they had chosen to do that, there would have been controversy around it, and probably some people would have disagreed with it. And I understand that. I think to some extent that would have been inevitable. If we'd just gone with teacher judgment with no moderation, I am pretty certain that there would have been a lot of criticism about us trying to overinflate achievements, and so we would have had an issue from the different perspectives. So this was never going to be easy. But what we've had is the SQA applying a moderation process, which got us to the results yesterday. And remember, 3/4 of grades were not moderated. But for the individual young people who did have results moderated, that is no comfort. I absolutely accept that. But we now go into a process of individual moderation, which is the appeals process, where any young person who feels that their individual circumstances have not been properly taken account of, and if they feel they have been disadvantaged by the SQA part of the process that's happened so far, they get the chance with their teachers to put forward that evidence. So this next part of the process, the appeals process is always important with exams, but it is more important this year because of the unprecedented circumstances. So this next bit of the journey is about individual moderation, where it is the particular circumstances of young people that will be looked at. So what I'd say to young people who are disappointed in the results they got yesterday, I understand that, and I'm really sorry that we had a situation this year where we've had to put in place something different because of the pandemic. We're trying to get it right, not just at the headline statistical level. That's not unimportant, because we want employers in future years to look at the 2020 results and not think that they're not valid. So we want there to be a credibility about them for those who did well, included in that. But now we want to make sure that young people who feel they have not had fair results, they get the chance to have their own individual circumstances looked at. So yesterday was not the end of that process. And I know this is really difficult for young people, but we are determined, and the SQA is determined, to try to get it right in a year that none of us would have wanted because of the unprecedented circumstances we've had to confront.
Sorry, First Minister, can I just come back on one point there? You said it's not the end of the journey and that the appeals process is open, but I've spoken to a number of parents whose children had their university places rejected within 30 minutes yesterday and are now in complete panic about this. They're scared about their mental health, they're scared about their children's future and where they go from here, and how long the appeal process can take because there's so many expected. I mean, what is your message to them? Because it feels like the end of the journey for some of them.
Well, it should not be the end of the journey, because it's not the end. Yesterday was not the end of the journey in terms of university clearance and the process either. The appeals process, I'll make sure we provide you with the precise dates around this in case I get them wrong here, but appeals have to be submitted fairly quickly by later this month. And then the SQA have also got an obligation to process these appeals quickly in order that young people do get the outcome of appeals in time for the university application and entry process, so that the timing of the appeals process has that very much in mind. And you heard John Swinney say yesterday, SQA is expecting, again, because of the absence of exams this year, that there will be a significantly increased number of appeals than is the case normally, and they are ready and prepared to deal with that greater volume of appeals. So from the outset here, we have known that the appeals process was going to be more important this year. I come back to my earlier point. It's like so much of what I stand here and talk about right now, I wish we weren't in this position. It's more than 100 years since exams didn't take place in Scotland. So this is a completely unprecedented set of circumstances. And in the absence of exams, there had to be a different process to award young people their qualifications. And I think there would always have been controversy whichever approach had been taken. So the part of the process thus far has been trying to make sure that there is an overall credibility, because that's important for young people. I don't want employers to write off 2020 results because they assume everybody was just awarded a higher grade. But the next part of the process is absolutely about making sure that the individual circumstances are taken account of. We do not want anybody to be disadvantaged because of the circumstances of the pandemic that are beyond people's control. But it does mean to get to that objective, which I hope we do, we have to take a different route than we would normally take. And I know that's really difficult for young people. I said yesterday, you know, it's a long time since I was in this position, but I do remember it as if it was yesterday, because this is such an important moment in the life of any young person. And I really feel for any young person yesterday that was looking at results that were not what they were expecting and is now faced with having to go through the appeals process. But that appeals process this year is there to make sure that we don't have young people treated unfairly, and that is why it is more important this year than it is in normal years. And lastly today, Tom Gordon from the Herald.
Hello, thank you, First Minister. Firstly, for this...
You've frozen, Tom.
GM.
Sorry, you froze. You've frozen again. I'm not sure I want to look at a frozen picture of you for too much longer, but your eyes are moving, so try again.
Okay, can you hear me now, First Minister?
Yeah.
Okay. First part was to the CMO. Is there any kind of picture of the cases involved in Aberdeen? Is it generally younger people because of the nighttime economy link, or is it a bit of a mixed bag? And are there any cases associated with oil rigs? And on the SQA appeals, the SQA draws very heavily on previous year's data for the moderation process. Will any previous year's data be applied to the appeals process? I mean, it knows, for instance, that broadly 1 in 7 appeals every year results in an upgrade to the mark. Will that be taken into account? Will national or school trend data be taken into account, or will it be true case by case and open-ended in the number of appeals which might succeed?
I'll hand over to the CMO on the point about cases. On that, I will make sure, rather than sort of try to explain this myself, that we give you proper detail of exactly the methodology that will be used in the appeals process, but it is in the appeals process for teachers to put forward evidence in the individual circumstances of young people, and that's so in the moderation process that's just gone through. It's, you know, I can understand that people see that and feel that that's a very statistical exercise. Appeals are more about the individual circumstances, but we'll make sure we provide more detail on exactly what the methodology of that is. Gregor, do you want to say, if to the extent you can, say a bit more about the profile of the cases?
So I think the first thing I would want to say is that I wouldn't want to be drawn on personal information in relation to any of these outbreaks, and that it's important that we respect each one of these cases' confidentiality. Having said that, I am not aware of any information in relation to occupation at this point in time anyway. I think if we look at the changing pattern of infections, not only in this country, but again, if we look internationally, what we are seeing is that at this stage of the pandemic, some of those younger age groups are beginning to become overrepresented from what we would expect. And I'm quite sure that when the detailed analysis is eventually given for this outbreak in Aberdeen, that we'll see some sort of similar pattern.
What we do know, and we've reported this a couple of times in the last few days, is that overall in Scotland, over the past week or so, about half of all of the cases that are being confirmed right now are in the 20 to 39 age group. So there is a much younger profile. And, you know, while we can't draw firm conclusions, obviously the conclusions that you might start to draw would be the link between that and what young people tend to do, go to pubs and restaurants and such like, which is certainly on the face of it what might be the case in Aberdeen, although we'll need to wait a bit longer for more of the detailed investigation. That concludes the questions today. Thanks, as always, to the journalists, and my thanks to Gregor and to Yvonne, who has been our BSL interpreter today. Thanks to all of you for joining. Today is an update I didn't relish given, as I'm sure you can appreciate, but this really does have to be a reminder to all of us of how important it is to stick to all of the advice. The virus is out there and it is ready to pounce anytime we give it the opportunity to. So please, to people in Aberdeen, you can get more, you will get more detail through the Scottish Government website, I'm sure from the Council and the Health Board over the course of today. If you have questions about the detail of what I have just announced, we will also keep you updated. There will be an SMS message going to people in the shielded category in Aberdeen later on as well. We are not reimposing the shielding advice on people, but there will be a message advising people in Aberdeen to be particularly vigilant, and we'll use that route to give any further updates that are necessary. To the general population, please abide by the facts advice and look at Aberdeen right now and remind yourself why it is so important. So please wear face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metres distancing, please remember that, and self-isolate and book a test if you have symptoms. Thank you for joining us today. I will be back here tomorrow at 12:15 for a further update, but my thanks for now.